Press 2 fingers into the skin just above your ankle bone right now. Hold them there for 10 full seconds and then release. If a small valley stays behind in your skin, even for 3 or 4 seconds before it slowly fills back in, your lymphatic system is failing. And what I am about to tell you in the next 3,000 words will explain why that single dent has been ignored by every doctor you have ever seen. That indentation is called pitting edema, and it is the visible signature of a system that moves roughly 3 liters of interstitial fluid out of your tissues every 24 hours. A system that begins to weaken silently after the age of 55. A system that affects an estimated significant percentage of adults over 50 in subclinical form. And a system that takes the average patient between 6 and 10 years of escalating symptoms to be correctly diagnosed. That dent you just found in your ankle has a name. It has a cause. And not one of your doctors has ever tested for it. The symptom-targeting model of modern medicine made absolutely sure you would never learn the real reason your legs feel heavy by 4 in the afternoon. By the end of this video, you will discover exactly why this was never explained to you, which of 3 swelling patterns your body is showing right now, and the one specific daily habit you can use starting tonight to restart the drainage your body was designed for. Subscribe so you never miss what the medical establishment hopes you stop asking about. To understand how this was buried, you have to go back to a dissection theater in northern Italy in the summer of 1622, and a young anatomist named Gaspare Aselli, who saw something inside a living animal that no one in 1,500 years of medicine was supposed to see. Aselli was a surgeon at the University of Pavia. On July the 23rd of that year, in front of a small group of colleagues, he opened the abdomen of a well-fed dog and observed what he described as milky white cords running through the membrane of the intestine. They were not arteries. They were not veins. They carried no blood. They carried a pale fluid that moved away from the tissue, not toward it. He called them lacteals, and his posthumous record, published in 1627 under the title De lactibus sive lactes venis, became the first complete documentation of what we now call the lymphatic system. Within 3 decades, Thomas Bartholin in Copenhagen and Olaus Rudbeck in Uppsala mapped the rest of it, tracing the vessels through the thoracic cavity and into the venous return at the base of the neck. The implication was staggering. Medicine had been treating swelling, edema, and fluid retention as a problem of blood for 15 centuries, and it had been wrong. There was a second circulation. He saw a system the entire history of medicine had missed. 300 years later, your doctor was trained to ignore it again. Here is the part that is humiliating in its simplicity. The lymphatic system has no central pump. There is no heart driving it. It moves entirely by 3 mechanisms: skeletal muscle contraction, deep diaphragmatic breathing, and a series of one-way valves spaced every few centimeters along its vessels. 3 liters of fluid every single day. Approximately 600 lymph nodes. A network that ultimately empties into the thoracic duct at the junction of the left subclavian vein. No pump means movement is the pump. When you sit for 9 hours, the fluid stops. When you breathe shallowly into your upper chest, the thoracic duct stagnates. When the calf muscle does not contract, the lower limb begins to drown in its own interstitial waste. This is not a theory. This is anatomy. And here is the twist that detonates the entire modern diagnostic narrative. The cure for the majority of chronic, non-pathological swelling is muscular movement and breath. That is it. It has been documented in the European clinical literature for nearly 400 years. It cannot be patented. It cannot be reimbursed. It cannot be prescribed. The body has been waiting for the one thing no pharmaceutical company can sell. By 1892, a Belgian surgeon named Alexander von Winivarter had published the first complete decongestive therapy protocol in his work De Elephantiasis, demonstrating that combined manual drainage, compression, and movement could reduce the circumference of severely edematous limbs by documented margins of 30 to 60% within weeks, with no medication of any kind. By 1936, a Danish-born physiotherapist named Emil Vauder, working with his wife Estrid in the south of France, had refined the technique into what is still taught today as manual lymphatic drainage.
The protocol was published. It was photographed. It was reproducible. By 1956, the United States had effectively buried it. Europe institutionalized it. America did not. The body itself, however, never changed. Let me show you what is actually happening underneath your skin right now. Behind your jaw, just below the angle of your ear, sits a chain of cervical lymph nodes that drain everything coming out of your skull, including the metabolic waste flushed from your brain overnight. Under each armpit, the axillary nodes drain your arm and your breast tissue. At the crease where your thigh meets your pelvis, the inguinal nodes form a bottleneck for everything below your waist. Deep in your abdomen, just in front of your first and second lumbar vertebrae, sits a small reservoir called the cisterna chyli, which collects fluid from your legs and gut before sending it upward through the thoracic duct. That duct empties into your bloodstream at your left collarbone. And in your calf, the muscle itself functions as what European lymphologists have called for over a century the second heart, contracting with each step to push fluid against gravity back toward your trunk. 6 pathways, 6 pressure points, 6 places your doctor was never trained to assess, and until 2015, every neurology textbook in the Western world said the brain itself had no lymphatic drainage at all. They were wrong. In 2012 and 2013, a Danish-born neuroscientist named Maiken Nedergaard, working at the University of Rochester, published a series of papers in Science Translational Medicine and Science describing what she called the glymphatic system, the brain's lymphatic equivalent drainage pathway. Her research demonstrated that during deep sleep, the interstitial space inside the brain expands by approximately 60%, allowing cerebrospinal fluid to flush metabolic waste, including beta amyloid, out through channels that exit at the base of the skull and connect directly to the cervical lymph nodes you can feel behind your jaw. 2 years later, in 2015, Antoine Louveau and Jonathan Kipnis published in Nature the discovery of meningeal lymphatic vessels, an entire drainage network inside the membranes covering the brain that had been declared non-existent for over a century. The textbooks were not incomplete. They were wrong. And what this means for you, sitting where you are right now, is that the morning fog you wake up in after 55 is not your mind failing. It is fluid that never left. Now here is where you need to pay close attention, because what comes next decides whether the daily habit I am about to give you helps you or harms you. Chronic lymphatic stagnation after 55 expresses itself in 3 distinct patterns, and your symptoms will fit one of them. Type 1 is gravitational stagnation, the lower body dominant pattern. Your ankles puff by mid-afternoon. Your socks leave deep grooves in your skin by evening. Your legs feel heavy on stairs that did not bother you a decade ago. The swelling vanishes overnight after lying flat. This type responds to calf pump activation and elevation. Compression alone without movement can worsen deep node congestion. Type 2 is truncal stagnation, the mid-body dominant pattern. Your abdomen feels bloated, independent of food. There is a soft puffiness across your lower back, sometimes a band of swelling along the bra line. You become breathless on mild exertion. Sitting for hours makes everything worse. This type requires deep diaphragmatic breathing to drive the cisterna chyli and thoracic duct, and diuretics for this type can collapse plasma volume and intensify the fatigue you are already living with. Type 3 is cephalic stagnation, the upper body dominant pattern. Your face is puffy in the morning. especially under the eyes. Your jowls feel heavy. The brain fog lasts until 10 or 11 in the morning. Your neck and trapezius muscles are constantly tight. Your symptoms are highly sensitive to sleep position. This type requires side sleeping and cervical drainage, and back sleeping with screen-forward posture during the day actively blocks the very pathway that clears it. Identified your type? Hold it in your mind, because what restores one type can actively damage another, and the single daily habit I am about to reveal works for all three only when applied to the correct sequence for your body. One of these three is yours. Your doctor was never trained to ask which. So the question is no longer whether the biology exists. The biology has been documented since 1622. The question is why. In 2026, your primary care physician has no test to order, no checkbox to tick, and no script to write for the system that moves more fluid through your body every day than your bloodstream does. The answer is structural, and it is the part that, once you see it, you cannot unsee. Lymphoscintigraphy, the imaging study that can directly visualize lymphatic flow, is rarely ordered, rarely reimbursed, and rarely available outside major academic centers. The ICD-10 diagnostic codes for lymphatic insufficiency exist, but the reimbursement structure surrounding them has historically been a fraction of what cardiovascular workups generate. Manual lymphatic drainage was classified as experimental by multiple American insurance carriers throughout the 2010s. The disease is not invisible. The billing code is. Let me make this concrete with a patient I will call Margaret. She walked into my practice at the age of 61, having seen 11 doctors over 8 years for progressive lower limb swelling, mid-afternoon exhaustion, and a dent in her ankle that stayed for nearly 10 seconds when pressed. She had been prescribed 3 different diuretics. She had completed a full cardiology workup that came back unremarkable. Her thyroid panel was normal. Her kidney function was normal. Not one of those 11 physicians had ordered a single lymphatic assessment. Not one. In 22 years of treating chronic vascular and lymphatic failure, I have seen this pattern repeat with such monotonous consistency that it can no longer be called an oversight. My name is Dr. James Whitfield, and what I watched happen to patients like Margaret across 2 decades of clinical practice is the reason I am sitting here telling you this now. And here is the second twist, the one that, when you understand it, changes the way you see every medical visit you will ever attend again. The lymphatic system was never disproven. It was economically excluded. The global market for diuretic medications has grown into a multi-billion-dollar industry. Manual lymphatic drainage requires a pair of trained hands and 40 minutes. Symptom-targeting medicine is profitable. Root cause restoration is not. The structure of reimbursement chose, on behalf of medicine, what medicine would remember. The standard American medical school curriculum dedicates approximately 4 hours to lymphology across 4 years of training. Compare that to the thousands of hours dedicated to cardiovascular medicine. Nothing was hidden. It was simply never paid for. And this is the part that sounds like conspiracy until you walk through the actual mechanics, because conspiracy implies coordination, and what happened here is more disturbing than that. There was no coordination. There was only an incentive structure, and the incentive structure quietly shaped 4 decades of clinical curriculum, 4 decades of insurance coverage decisions, and 4 decades of GP training, until the entire system arrived at a place where your doctor genuinely does not know to look, and even if they did, has no test to order and no time to investigate. Now here is where the story becomes impossible to ignore, because the proof is not pending. The proof already exists, sitting inside institutions you already trust. Research on lymphatic drainage and the lymphatic clearance system has been published in NIH-indexed journals, cited in Nature, replicated at the University of Rochester and Harvard-affiliated laboratories, and discussed in peer-reviewed American clinical literature. The data is in your country's databases. It has still never been translated into a conversation your doctor has had with you. And in Europe, the application has gone further. At the Foldy Clinic in Hinterzarten, in the Black Forest region of Germany, Michael and Ethel Foldy spent decades documenting the outcomes of complete decongestive therapy in monitored patient cohorts. With limb volume reductions reported across studies, and maintenance of those reductions tracked over 12 to 24 months, achieved without pharmaceutical intervention. The Whittlinger schools in Austria have trained certified lymphedema therapists for over 40 years. Germany has a publicly reimbursed lymphology specialty embedded in its national healthcare system. The map of where this knowledge lives is also the map of where it pays. American medicine did not lose the data. It never imported it. While your doctor reaches for a prescription pad, a clinic in the Black Forest has been treating this condition with documented protocols since 1981. Which brings us, finally, to the daily habit. 3 minutes. No prescription, no specialist, no code. It is called the 4-7-8 diaphragmatic lymphatic drainage sequence, and it is performed once each evening, ideally in the hour before sleep. You inhale through your nose for 4 seconds, expanding your belly outward rather than your chest. You hold the breath for 7 seconds, which engages the thoracic pump and increases pressure across the cisterna chyli. You exhale slowly through pursed lips for 8 seconds. As you exhale, you perform 20 slow calf raises, rising onto the balls of your feet and lowering with control. The diaphragm is the primary driver of the thoracic duct. The calf is the primary driver of lower limb return. Together, in 3 minutes, they replicate the mechanical conditions the lymphatic system was designed to receive across an active day. If your symptoms match type 1, emphasize the calf raises and lie supine with your legs elevated against a wall for 5 minutes after. If you match type 2, emphasize the depth of the diaphragmatic breath and add a slow, clockwise self-massage of the abdomen following the path of the colon. If you match type 3, emphasize side sleeping afterward and add gentle downward strokes from behind your ear to your collarbone before bed, which manually assists cervical drainage. Clinical observations from monitored patient cohorts and what 22 years of treating lymphatic failure has shown me directly suggest that consistent application of this sequence produces measurable changes in evening edema within roughly 2 weeks for many patients, though individual response varies, and this is educational guidance, not personal medical advice. The body does not forget. Margaret, the woman I described earlier, returned to my office 16 weeks after beginning a version of this protocol. The indentation in her ankle no longer stayed when pressed. The afternoon heaviness was gone. A retired school teacher in his early 60s, prescribed diuretics for 7 years for what had been called age-related swelling, reported that his morning facial puffiness and the cognitive heaviness he had been told to accept as aging had receded by the end of the 3rd month. These are not miracles. These are the predictable documented responses of a biological system that has been waiting 400 years for someone to give it the conditions it requires. The lymphatic system has not changed since Aselli watched it shimmer in the mesentery of a dog on a summer afternoon in 1622. It still moves 3 liters of fluid out of your tissues every single day. It still has no pump. It still asks for movement, for breath, for sleep on your side, for the calf to contract and the diaphragm to descend. The biology has not aged. The pathways have not vanished. The vessels have not narrowed because of any market force or diagnostic code. The body is still waiting, exactly as it has always waited, for the conditions it was built to receive. Press your fingers into your ankle one more time tonight, before you sleep, after you have done the breathing and the 20 calf raises and turned onto your side. The valley will be a little shallower. The skin will fill back in a little faster. The medicine was never lost. It was only unprescribed. And tonight, before you sleep, your body is ready to remember. This content is for educational purposes only and does not constitute medical advice. Always consult your physician before making changes to your health routine.